a few thoughts and comments, and then I'll hand it back over to you. First of all, I want to express sort of my gratitude that all of you are spending this next hour and a half with us. What is a really kind of crazy time now. The fall and January 1 starts and renewals is a stressful period for all of us. But you as producers and brokerage houses, more so than even us. So thank you for spending the time. And I want to sort of remark on a couple of things that I think you'll hear from the team that are important for us to sort of remind you of in the value proposition that we think we bring. And our journey from an outsourced shop to almost actually a fully in-source shop has been completed now for the better part of 2 years. Bringing claims in-house and now bringing the majority of medical management back in-house for a really solid operational footprint. Our focus on member service and a local presence and a highly managed product. I think you'll hear more about that from the team, so we're really proud of that. Our financial stability now, our climbing out of losses from 15 and 16, have been capped off by what is really, quite a feather in our cap. We were the lead plaintiff in the Supreme Court risk corridors case, and we have received a repayment on our risk corridors of $50.1 million. So we're really quite proud of leading all the payers in the country in that process. I think you'll hear a bit about some interesting new approaches to enhancing our online systems for large group underwriting, which I know many of you will look at as an opportunity to get better insight into how your RFPs are managed, insight into the underwriting process, and lots of more direct feedback and getting quotes back to you quickly. So I know you'll hear a bit about that. And you'll also hear about PioneerASO, if you haven't heard already, about our launch of our self-funded product, which we're really proud of, which sits on top of our operational and medical management chassis. We really think we can offer self-funded employers in the state of Maine an alternative, a very highly managed and local and transparent option for those of you who have a self-funded book. So I'll stop there. I'll also mention that the team is able and willing to come out to you. So although we're still in a bit of a crazy time, we have cleared our staff for in-state travel. And so obviously operating within the guidelines of the Maine CDC, keeping everybody safe. We're happy to come out, engage with you, or engage with employers as necessary during the really important sales and retention cycle. So I'll pause there. That's what I wanted to say. Again, thank you for your support and placing business with us. And we hope you will take that trust to new levels and send us quotes, help us with retaining clients and sending new business our way. So thanks again.
Great, thank you, Rob. Just a few housekeeping items as we kick off the meeting, and we'll get right into the slideshow and the presentation in a few moments. But I did want to just take a moment, and many of you know me, but I'd like to also have you be familiar with our other speakers today. Tammy Walsh, as you know, is our group sales manager. She'll be joining us. And if you want to just give a wave, Tammy, and say hello.
Hello.
And then we also have Renee Leza, who is our lead on our launch into PioneerASO. And Renee's going to talk about the project itself, PioneerASO, and our approach to that business. So if you want to say hi, Renee.
I was about to say good morning, but I probably should change that up now and say good afternoon.
Good afternoon, yeah. But yeah, with that said, just a few other housekeeping items. We do have Maureen Mazur, who's going to just talk very briefly about individual coverage HRAs. We suspect that some large employers are asking about them, and Maureen is in our small group market. She's going to just talk a little bit about that as well. Thanks, Maureen. Just to get started, Ariel Thomas, our coordinator, is running the meeting this afternoon, and she is in charge of all of everything Zoom. So we'd ask for you all to be on mute during the presentation, and because of the large number of people on the call, we traditionally would handle questions through the chat feature, but today we're going to handle it a little bit different and ask that you send any questions regarding any specific slides to the email address, the business development email address, and I believe Ariel is going to provide that through the chat if she hasn't already. What we plan to do is compile all of the questions, and then we'll pull together a Q&A. And also provide you with a copy of the PowerPoint presentation so that you can also self-serve some of those questions after today's session. I'd anticipate that the Q&A would be out within the next day or two, if not early next week. But always, you have the account teams at your fingertips. If there's something pressing or urgent, you can certainly reach out to them as well. Again, everyone will be muted. We're also going to record this session in case folks aren't able to join due to competing priorities. And I think, Ariel, that's it. Why don't we go ahead and start the presentation? And we can move right on to slide 1. So today, we're going to break the presentation out in four distinct areas. We'll just go over some information and news. We'll cover plan highlights and benefits. We're also going to have Renee talk about PioneerASO and the launch of that product and details that you'd want to know about that if you haven't heard them already. And then we'll do that deeper dive into plan details on Tammy's side in the large group market. And then just some housekeeping and administrative items that are probably more of a reminder than anything else. The other item that I would just like to add that if you're self-serving and attending more than one session, as an example, this afternoon's session, we're diving deep into large group and ASO. Earlier in the day, we had a session about small group. And tomorrow we'll have another session about the individual lines of business. If you find that you'd like to attend multiple sessions, you're more than welcome to do so. Just understand that there will be some information that is duplicative over the course of several of the slides. For example, some of the marketing information that you'll hear about. But we'll try to keep it as interesting as possible and engaging for you as an agent. Slide 3 or 2, excuse me. And next. Thank you. So many of you have probably noticed we've gone through a rebranding. We have this new, fresh look, but one thing is for certain, that is we're still with the same mission. We're still have the same vision and still want the same outcomes and outlook for our members, which is to partner with insurance agents and partner with businesses, but also keeping a keen eye on keeping costs low and ensuring that our members get the best care possible. There's a few items that I think are definitely newsworthy. Some of these items tie in nicely with some of the information that Rob shared earlier. But I'll start with the first bullet, which is around scoring a score of 47 out of 50 points for our NCQA survey results and in national accreditation. Rob touched on the fact that we're demonstrating that we're financially healthy, with a little bit north of 84 million in capital surplus, which has doubled since 2017. And there's a few items that are contributing to that, one of which is 8.5 million saved through care management programs since 2017, where we're really helping members save money and putting that work towards keeping premiums low. And then also 31% reduction of year-over-year hospital admission rates, where, again, we're working to keep members healthy and keep their costs low. Both of those items contribute to that capital surplus, and that work is ongoing. I'm very proud to say that the business development team, with the business that has come in on the books in the small group and large group markets to date, in 2019, we had about approximately 93% year-end retention rate. And I think it was a little bit higher than 93. So I'm bragging a little saying 93 is conservative. But I'm very proud of the work that the team does in renewing and keeping business on the books and really contributing to what I see as member satisfaction, but also broker satisfaction as well. And then lastly, in 2019, we were voted as one of the best places to work in Maine, and we're very proud of the work that our employees do and how that contributes to, again, that member and broker and all of our partners that we work with every day and their satisfaction. There's a few news items that Rob mentioned as well, one of which is the Supreme Court ruling. Again, we're very pleased with the results. It was a long process, but I always like the old saying, good things come to those who wait, and it really turned out in our favor. We're also one of 3 co-ops remaining in the United States, and as I speak right now, there actually are 4 remaining co-ops through the end of this year, but in 2021, there will be 3 co-ops. I believe it is the New Mexico co-op that is going out of business at the end of the year. But that enforces, again, the work that we do, our mission, our vision to providing good quality health benefits for the people in the state of Maine. Renee's going to touch on PioneerASO, so I won't steal her thunder there. Just a couple of other reminders. We are looking at the 2021 board directors election, which is up and coming, so you may be seeing correspondence about that in particular if you're a member or your clients may be asking about it. And lastly, we'd be remiss if we didn't talk a little bit about our response to COVID-19 and all the work that's going on there, enhanced benefits by way of cost sharing reductions or waiving as it relates to COVID-19, and you probably have read that in some of our news bulletins. Also, some of the money that we've given through community grants to other local nonprofits who are, really struggling to provide with a lot of really basic needs throughout the summer, and I think it was more recently in July that those grants went out. And then lastly, we also, at least anyway, the business development team, and I'll call out Sarah and Matt, the great work that they've done in working with you, but also working with employers who needed help with the extended grace period premiums. We very much care about our clients and their ability to continue to pay, and also the impact that COVID-19 is having on them. Another initiative that we're also very, very proud of is the fact that our med management team during COVID-19, at least in the early spring and early summer, went out with a very aggressive call campaign to at-risk members to help them get the tools that they might need to stay safe and healthy during the pandemic. Our member services team is also a very important part of what we do every day. And I know that in years past, and the reason I mention it is we have had issues where employers, members, as well as brokers have had difficulty getting through to our member services team. But I'm really grateful to be able to show you this slide, especially in areas of turnaround. A couple of programs that I've spoken about in the past, one in particular is Promises Made, Promises Kept, where members, if they are promised, or any partner, if they are promised a callback, that they get a callback within a certain period of time. We also take very seriously our member survey results, and they're 3 simple questions that are asked at the end of every call. And 99% of our customers and partners are telling us that they were treated with courtesy and respect. 98% of them tell us that they did receive the information that they called us for. And 98% also tell us that the speed of answer was definitely acceptable for them. So in summary, our member services team is a very strong foundation of who we are and what we do, and they really are a strong reflection of the local flavor that you'll feel from us as a company, but also it just showcases the great quality work that they do as well. So with that said, I will turn it over to Renee and let her have the privilege of talking about PioneerASO. And I think, Renee, I come back to talk a little more about our marketing efforts before we turn it over to Tammy.
Okay, great. Thanks, Sharon. So thank you everyone again, just to extend that thank you for taking time out of this super busy time of the year to spend a little time with us and learn about all the exciting things happening for 1/1 and beyond. So for those of you who haven't gotten this formal introduction to PioneerASO, really what we're trying to do here at Health Options is to really maximize the core concepts that we already have built into our platform based around a highly managed care model, very member-centric and also focused on cost containment, and introducing this to the market as a self-funded option for main employers. We are going out of the gate for 1/1 in about the 50+ market, so 50 enrolled employees is sort of what we're targeting to start our launch. PioneerASO, we did get some questions earlier this morning. What is ASO? And really it is just administrative services only when it comes to a self-funded plan. So by way of introduction, we really want to make sure that the market and you all have an option for your employers where they can really closely monitor and manage their healthcare spending, more so in a traditional fully insured approach. However, we do have an integrated approach on the fully insured side for employers that are looking to kind of take a step up in that model, and I'll talk a little bit about that. One unique thing is, like the fully insured side, each employer is individually underwritten. We have partnered with very strategically with stop-loss partners and MGUs to make sure that we're getting the most favorable underwriting in the market based on our model specifically. And so we have carefully selected a group of partners for our stop-loss relationships that we will be going out to. I will say we have been responding to RFPs for 1/1, and I'm really encouraged by what the market is, how it is responding, and how the carriers are responding to this product. And very competitive quotes coming back, just given how we really wrap our integrated model around this. One opportunity really that employers will have in a self-funded model is a little bit of flexibility in plan design. We will be rolling out the ASO model for 1/1 with selected plan designs that we've carefully taken a look at from the large group model, and really have tweaked them to be more specific to a little bit more flexibility in some of the benefits that do not fall under state regulations, and that can have a little bit more impact on the cost containment side of things. So we really see an advantage with this program in direct impacts in cost savings and wellness programs, and true meaningful information back to the provider. These plans will be governed by ERISA, not the state of Maine, and of course will be exempt from state regulation and premium taxes. So sort of a triple benefit there with. You can go forward, Ariel. Thank you. One thing I do want to mention also, and we're really excited and proud of this, is that we are in 2021 bringing all of our medical management and utilization management under our umbrella as a part of our integrated model. So by 2021, we will be transitioning all utilization management services in-house. And I think it's important to recognize that we really want to improve our communication with the providers, We want to provide a better experience for the members from the utilization management and authorization side. And we really want the ability to make sure that we recognize any opportunity for referral into our med management department as it relates to anything with complex care management, maybe a high cost claim coming down the road, and really be able to identify those through our triggers in-house. And so that is something that's very exciting that we're bringing in-house for 2021. We definitely have a very unique approach in the market already as a core foundation of our model. But I think as we launch this ASO model, I think it becomes very important for employers and yourselves as the brokers and advisors to really have the information necessary to make really meaningful decisions based on a health plan. So I think one of the things that we're starting out with first and foremost is our commitment to making sure that you and the employers have meaningful data to make those decisions. You'll hear a lot in the market that, you know, a lot of these carriers have transparent data and everything is transparent, which we are committed to, but I think we're going to take it a step further and make sure that you not only have transparent data, but that you have meaningful data and that we discuss it on a regular basis. It's proactive, there aren't any surprises, and you know, employers will really become engaged in managing their plans. Our dynamic duo in-house teams, our medical management and our in-house pharmacy teams go above and beyond in the way that they manage the members from a care management perspective, but also from a quality control perspective and from a cost containment perspective. So we want to make sure that all of our model really syncs together and works together in-house, along with some of our programs that we're rolling out for 2021, which we'll talk about a little later. But it really involves taking all of our data that comes in from claims and utilization management and doing some real proactive outreach to members for opportunities of transitioning care to a lower cost facility or making sure that you're getting the appropriate and best referrals to a center of excellence. Those types of things are very important in managing a self-funded plan. And of course, we have our local account management team, and that is something that from the start, we will be committed to being there, being hands-on, and being present, making sure that the employer has everything they need from the perspective of a transition and a smooth transition, and to make sure that our member support team is there. They're well educated in the ASO space. We've been going through internal trainings and making sure that everything is ready to roll for 1/1. The members also, and Tammy will talk a lot about the support that they'll have on their end with all of the portal tools and everything that we have for self-serving for the members, but we also have our member support in-house as well. So all of these teams work very collaboratively together to provide a really good place in the market for a self-funded plan. This, I think, again, this is something that we do now in terms of population health management on our health options side. But I thought it was important to also mention it on the ASO side of things too, as it relates to really how we're going to take these plans to the next level in the ASO space. All of our population health management programs are specifically designed, evaluated, and executed with a high volume of success in a lot of case studies that will be very important to know about and to learn about as a self-funded employer. Our complex care management really is laser focused on making sure that any complex case, illness is taken care of from a high touch, high quality perspective. Things like metastatic cancers, organ transplants. My cat likes to say hi sometimes and I apologize for that. Our organ transplant network, I just want to touch upon real quick, is a thorough, very competitive organ transplant network, but we do tend to go above and beyond that as well. So we don't just rely on that from a member perspective of quality care, but also from a cost perspective of the claim itself. Any pediatric intensive care, NICU claims and premature births and labors, those tend to be very large claims when it comes down to it. And those are the types of things that we will be all over and managing, again, from the member perspective and from the employer perspective. Our end-stage renal disease program really hits it out of the park from day one when there's bells and whistles that go off that someone could be end-stage, and making sure that all of the checkboxes are checked off in terms of Medicare, enrolling into Medicare, getting on the transplant list, making sure that we have a dialysis network set up that's competitive. All of those things are coordinated in-house by us because we have the information to do that. We also have our care management team, again, really focusing on transitions of care, prevention of readmission, prescription drug reviews, maternity and postpartum care. We are actually rolling out a very specific behavioral health network and making sure that we're paying close attention to the 7-day follow-ups after an admission for behavioral health. So all of those things together also remove a lot of the barriers that you see in the healthcare system for members when it comes to point of service care, medications especially. Out of network and out of area support is absolutely something that we also handle. It's not just our proprietary network of providers that we work with. We will talk a little bit about infusion services in our new site of care referral program, which provides incentive-based opportunity for members to transition their care to a preferred outpatient infusion center, which is a huge and significant savings to the plan, but also better experience for the member. And then lastly, but definitely not least importantly, is our focused outreach when it comes to chronic condition management, making sure that we're identifying gaps in care for chronic condition management. We have an extensive asthma and diabetes outreach program, and we really try to identify opportunities to engage with members proactively. One thing I am excited also, and I think you guys can definitely appreciate this as well, is if you do have any fully insured employer groups, large employer groups that really want to dive into the self-insured world and feel like they're ready, we do have something that we're rolling out in 2021 called the ASO Step Up Plan. And this really takes advantage of a fully insured employer that may not have enough meaningful data or information to really make a meaningful decision to transition into self-insured world. And so what we'd like to do is to offer a step-up program for fully insured employers to really come on board with health options as a fully insured employer, but really the way that we would manage their data and manage their claims and alike would be very similar to the self-insured world. And really what this provides for these fully insured, Ariel, can you skip to the next slide? Because what this really is going to provide is a strategy and a plan for these fully insured groups to really become educated in their health plan. They receive meaningful data from us. We'll even do monthly educations on self-funding to prepare them and get them ready. One very important thing is that we can identify and minimize the risk for these fully insured plans to really prepare them for self-funding. So we're seeing this as a 1 to 2 year transition where they would come on to health options as a fully insured group. And then we would have all of the information in-house and all of the clinical and claims data to be able to really go out to the market after about that 9 to 12 months of data and have really solid data to be able to provide to the market and to the stop loss carriers to get a really competitive self-insured quote. And so we're really excited about this, and I'm more than happy to take this offline with anyone one-on-one for this opportunity. And it really provides also these main employer groups a strategy and a long-term vision and option for their health plans. And I think that's it from my perspective. Again, appreciate everybody's time, and we are accepting RFPs in the ASO space for 1/1. We do have a fairly quick turnaround on those, and making sure that you have all the information that you guys need to provide back to the employer groups for a proposal and a quote.
Thanks, Renee. I think just a couple of things to Renee's point, especially with the Step Up program. I think it's probably obvious, but I'll state it anyway, that you all as agents and brokers who have the opportunity to potentially see who these employers are who might fit into that program, you'll also have the ability to work with both Tammy and Renee during this critical time of transition, and that really we see ourselves as one big team, and it's a win-win situation with whatever product fits for the employer. So I just leave that as you know, there's no silos in our sales team, and we work very closely together to make it work for the best for the employer. Also too, before I move on to the new digital sales, and I apologize, my short-term memory isn't so good, but I might not have mentioned, did I mention the rebate checks, 2019 rebate checks? I might have missed that on one of the slides on the updates, but at the end of September, we issued MLR, or medical loss ratio, rebate checks to those members who were enrolled with us in 2019 in the individual market, and then any large group employer who was enrolled with us in 2019. Long and short, the total amount of rebates issued was around $9.4 million. So I think it's really important. Many of you may have gotten calls from customers, but I didn't want to overlook that, and I think I skipped over it in the slide. That being said, let's move on to new digital sales tools. Our marketing team has been really doing a fantastic job in supporting us. And, you know, part of the building of these tools really revolves around what the sales need is. And so my team is really able to work closely with the marketing team and articulate the needs that you have. And we feel pretty proud of the work that we've come up with, and I'll show you over the next several slides. But essentially, we have digital sales tools that will really help us go green and save money, and help you save money as well. So with that, Ariel, let's go to the next slide. The first new member online guide is really just a member focus. This one that you're seeing in the slide is for a group member. And the approach that we've taken with these is that any member material will be stored within the member portal. They'll have access to go out and retrieve it. But you as an agent or a broker will also have access to it. Ariel, if you'll go to the next slide, I'll explain a little bit about the actual broker book. So we've created a new broker guide. I think the booklet itself is 80 plus pages, and it really gives you an opportunity to find all of the information you need in one place. It also allows you to print down specific pages, provide those specific pages to clients or for your own personal use or use for others in your office. And also too, if you find that there's material in those books that you feel might be helpful during an employee meeting, you can download those pages and print them off as well, or just, again, provide them to the employer. But essentially, it quickly gives you what you need at your fingertips, all the plan details, you know, any contact or logistical information that you might need to support your clients. On the next slide, Ariel, thank you. This is just a sample of what you'll see when you open the book. And by the way, I do want to remind you that last evening we sent out a broker blast reminding folks about the training today. But what we also did is give you a link in that constant contact blast that takes you right to this guide. And I'm hoping that most of you had an opportunity to look it over. But what I love about these books is the ease of using them. If you go directly to the table of contents, you'll be able to skip to any section that you like, from, you know, the medical and care management section down to pharmacy, or tools that you might need on broker support. And then in addition to that, the appendix actually has all of the sales tools right at your fingertips, from the large group grids to anything in the small group market. So I really am, again, am proud to talk about these great improvements. And I'll just raise my hand and say, for many of you who were with us in 2013 and 14, we dreamed of these tools, and today they're finally here. So it's great news. We're also doing fall marketing, anywhere between renewal letters and also calls and call out campaigns. Ariel, you can go to the next slide. Really what is important to know is that there's a few things with the letters. Renewal letters, of course, for all individual members have gone out. It's important to know also that today the storefront for the individual market is live in the portal. Folks can go in and self-serve. But our small group and large group renewals have been in the portal since around the 3rd of October. And renewal letters for those two market segments are also going out. One of the other items that we talked about with the digital sales tools is also being able to push into look at win-back campaigns, understand, you know, where we've had losses of membership. And primarily that's focused on the individual market as well as the small group market. And I guess what I really want to convey is that these initiatives are really to just get employers and individuals to ask their broker about us. We really want to work with our brokers so that we can remind members with our new fresh logo that we have changed, and things have changed since maybe they were with us, and they'd be willing to look at us again. Some of the fall marketing advertising has been taking place. I think they've been out for a couple of weeks now. I would love to be able to show you the YouTube videos for some of these ads, but unfortunately we're on lockdown with security, which is better safe. So we'd ask that if you'd like to view some of these, you can type them in your browser and view them with the links provided at the bottom of the slide. Our approach is still very similar to what we've done in the past, which is traditional media, television, focused on the individual market, the small group market, and then, or small and large group market, as well as PioneerASO. You'll also begin to see some changes, a little different than what we've done in the past, with more social media ads, including LinkedIn. We also, through our brand initiatives and brand enhancements, have really enhanced our website. Like any company, a website's critical to business success and putting tools out there for our partners as well as clients to be able to self-serve. And we've been keenly aware of improvements to the website, but also with an eye of how we can save an administrative expense, most of which is through self-service and electronic documents and the like. So next slide, Ariel. The member portal, many of you already know this. It's a feature that allows members 24/7 access to their plan. They've got to have their member ID card to go in and create an actual account. But once they get in there, they can self-serve on all their member benefit agreements, their summary of benefits and coverage, as well as receive and locate schedule of benefits. The actual member dashboard looks like this when a member actually rolls in and rolls in and actually goes into their own personal member portal. Securely, they can, of course, look at all those benefit documents I mentioned before, but they can also do other items like add a primary care physician or change a primary care physician. And again, like I mentioned, really with a keen eye of going paperless, maybe signing up for an opt-in benefit of looking at EOBs electronically. Same thing for individual members, for example, who might want to pay their bill online. But we also offer that feature for group administrators as well. But more importantly, it's really just an easy way to get updates and stay informed about us in general. Really proud to show you copies of our ID cards. You know, especially with our new brand, the information on the cards is generally the same, but the logo's new, and you're also getting a little snapshot of what the Pioneer logo looks like and how it's powered by or under the umbrella of community health options. So a lot of work went into creating these cards, and again, we're really proud of our marketing department in the work that they've done. I do want to point out the card that has the Delta Dental logo on it. This actually is a sample card for small group. As you know, our small group plans have embedded pediatric dental, and we actually print the cards on behalf of Delta Dental. However, Tammy's going to talk a little bit about, many of you know, our initiative, our joint marketing initiative with Northeast Delta Dental, and that is a segment where we do not print the cards for Northeast Delta Dental. Enrollment is separate, and Tammy will talk a little bit about that. So Tammy, I think this is where I turn it over to you.
Yes, it is. And many of you maybe have seen me looking out both my windows here because, of course, my neighbor is trying to power wash his house and the street sweeper is going up and down my street. But my little dog is being very quiet on the floor. So pleasure to be here. Happy that you have all attended. For those of you, honestly, we prefer to do the face-to-face meetings like we have in the past. But the one thing that won't happen today is I won't fumble with that darn remote going forward and backwards and not figuring out how to use the remote. So anyway, welcome all. And Renee, if you want to move to my next slide, that would be great. And I'm actually going to be looking on my larger monitor, so bear with me. We've got great news with some additional products for our large group plans in 2021. We have introduced a PPO $500 deductible with both RX1 and RX2, and I'm going to talk about the changes to RX1 and RX2 in an upcoming slide. We also, we're seeing a lot coming in on our quotes where they had a higher deductible for both an HSA and a PPO, so we're introducing a PPO 6500 with 20% coinsurance. And there will be a matching PPO HSA with the same deductible and out of pocket. I see a lot of times, in particular, the group may have a $5,000 PPO and then a PPO HSA 5,000. So I thought that was important to have the same plan both in the fully insured and the HSA. And again, zero copay now will be introduced in our RX2 plan. And I've got more details on that moving forward. Tier 1 will be well, let me back up. Most of you who have enrolled business, your group has been enrolled with RX2. At the renewal in 2021, you will be moved, those folks will be moved to our RX1 benefit. So it's a little bit of a better benefit. So we're not taking anything away when we move from RX2 to RX1, which is very important for you folks to know. New in 2021 too is the reduction in the RX2 copays. And you'll see that in a moment. Also new in 2021, the state of Maine has a mandate for those of us diabetics out there, and there are a lot of us, the maximum cost share for insulin will be no more than, it won't exceed $35. So this is a great benefit moving forward. This is going to be very beneficial to, as I said, diabetics. And it doesn't matter either what tier of insulin they're taking. So some of us are using a vial with an insulin pump. Some of us are using, a vial of insulin with injections. There's insulin pens. There's all sorts of things on the market. But this cost share will apply to everyone. Next slide. Oh, you're ahead of me. Good job. This is a summary of our large group benefits. So you're going to see the new low deductible plan, should you want that. And I've actually seen quite a few of those coming in for January 1st. 2 prescription benefit pricing groups, so RX1 and RX2. And again, the RX2 will now have a 0 copay on the tier 1 preferred generic. So it's a richer plan. And of course it will impact the rates, but for an employer that wants to continue to offer a better, richer prescription plan, they can get that with us. Chronic illness support program, we'll talk about that, the drug formulary. Basically all of this we'll cover, but this just gives you a brief snapshot. Excellent. Got some exciting news for you, really exciting news. So everybody pay attention when we get to this. The deductible credit allowed when moving from another carrier. PCP selection is required on all plans. And as Sharon said, that can be updated in the member portal, or they may certainly call member services to have them assign their primary care physician. All of you probably are aware of Bulletin 436, which was implemented last year regarding the methodology of counting eligible employees in the large group market. The good news with this is there's no more full-time equivalents and all that, ticking and tallying to get to where the number of eligibles is. We are now simply basing it on the number of eligible employees. So much simpler way of counting. As you all know, we've been very successful with our claim feed to Group Dynamic. A group can select either a paper claim where they want to have more of the onus on the employee, or we can certainly do that direct feed. I'll talk a little bit about our joint marketing initiative with Northeast Delta Dental, NED. That has been extremely well received in the large group market as well. And I'll talk about the health risk assessment tool. Can't talk. Has been eliminated beginning 10/1/2020. That was a very underutilized benefit, and I believe we will probably see that come back at some point to be used in the ASO market. Thank you. So here are the 2021 plan changes and updates. You will see, it says we have 22 large group plans, but if you count both RX1 and RX2 as an available option, there are actually 44, but don't be afraid. They're all pretty simple to see. The one thing I'll call out is, And many people will ask me, what is the Cornerstone PPO 3500 20% no D or NOD? That means that there is no deductible applied to tier 4 and 5 before you start in with your co-insurance. So there's a big difference between the 3,500 and that 3,500 no D. And again, if you'll notice that there are plan options that indicate RX1 and RX2. There are a handful of plans on there that are just subject to deductible and co-insurance or deductible only. Those plans, as they did last year, do not have the availability of RX1 and RX2. Next slide. Again, our robust provider network, we are continuing to grow our network, our proprietary network. We are fully active, and we have our proprietary network in both Maine and New Hampshire. We continued with our New Hampshire providers after we left the state of New Hampshire. We still have the centers of excellence in Boston that are that have proprietary contracts with us. And we continue to grow our regional proprietary network. And also, as you all know, for any companies that have employees outside of Maine, say in, Utah or Florida, I'd like to be in Florida, they will have access to our WRAP network, which is the First Health network. And I am turning this one back over to Renee.
And unlike you, Tammy, I'd rather be in Utah because I heard they have snow already to start.
Yeah, you're right. That's true.
So one of the things that we're really excited to not only launch for January, but to continue to grow is our site of care program. This is something that has had a significant impact on the fully insured plans already to date. And as of August 1st, we actually rolled out an incentive program for infusion therapy. So if you do need to use, or a member on the plan needs to use an infusion center, as we all know, the cost of prescription drugs are going up, but more so on the infusion specialty side, and more so if they're being administered in a hospital setting. And so what we're trying to really do is identify opportunities with outpatient infusion centers and lower cost centers that are still high quality and provide excellent patient care and excellent outcomes to redirect those members to those lower cost centers and provide them sort of an incentive and to share in that savings. So we have rolled this out on the fully insured side. Members are able to actually earn up to $1,000 a year based on the drug that they're having infused in the tier that drug falls on. And that's on the fully insured side, but on the self-insured side, starting in January, employers are actually going to have the option to put this incentive into place at an amount that they feel is appropriate to pay out and to share in that savings back to the employees, because on their plan, it really is their money. It's coming out of their pocketbooks. And so we're really going to give them the ability to design this program how they want to design it in terms of what the incentives will be. We are looking to grow this program as well in 2021. We're looking at joint replacement bundles and other orthopedic procedures to add to our site of care incentive program. So this is really exciting for the market, really exciting for employers to be able to engage in this type of these types of decisions based on their healthcare for their employees. Again, this is not something that's mandatory. It is incentive based, and a lot of times when you're talking about patient care and reaching out in an outreach effort, the carrot tends to work a lot better than the stick in these situations, and so these incentives have been highly successful so far. I wanted to also show you an example of what we're able to do in-house, collaborating with our claims team, our in-house pharmacy team, our med management team. And this is really how we identify opportunities for these types of transitions of care. So this is an example of Remicade. Remicade is an infused drug usually used for autoimmune conditions such as Crohn's and conditions similar to that. If you were to go to an inpatient setting, or I won't say inpatient, I'll say hospital outpatient, in a hospital setting, this drug is going to run you close to $9,000 for one session or one dose of this drug, which is usually around about 40 units. If you were to use an outpatient infusion center, that's going to be a cost of about $2,200. And so you can see the significant value in the savings. And also you can see the significant value in using this data in a really meaningful way. And so these employers are going to be able to identify these opportunities to say, with my own data, we have 6 cases of Remicade. They're all going to hospitals that are $23,000 a pop, because I've seen them that high before. And we could be redirecting to $2,300 each time that they go. And so this is the type of stuff that we really want to capitalize on with all of our in-house resources, with our pharmacy team, and also be able to deliver out to the employer groups. And I'll turn it back over to you, Tammy.
All right. So telehealth for primary care visits. We, especially now, we remove the barriers and obstacles for members if they want to access a telehealth visit with their primary care physician. As long as the the PCP offers telehealth, the visit will be the same cost as in-network or out-of-network provider office visits. The other thing I want to talk about here is Health Options Online. We introduced this, I think, last year, but it could be 2, the way time flies. But this is a service that folks can use through Amwell in order to seek services related to substance use disorders, or, you know, if they want to talk to a behavioral health counselor. And this is very important for folks that are in the more rural areas of Maine to utilize this. So it's a great program for folks. The next slide, preventive services. We offer 100% of the preventive care benefits required by the federal government and by the state of Maine. We also provide full coverage for flu vaccinations. And I might add here too, that for the large group employers and for small group, as long as they have a minimum of 25 attending, we have a partnership with Hannaford, and they will go on site to a group. Again, as long as they have 25 people attending, they will go out directly to the site, the business, to have a flu clinic for folks. So if anybody's interested in that, certainly let me know and we can give you more information. We cover the preventive screenings. We also cover preventive counseling, which usually occurs when a person has been identified but not yet diagnosed. So this is a great piece as well. All non-HSA large group plans include CISP, our chronic illness support program. And you probably all know that I love talking about this because it is something that is very helpful for folks that are managing chronic conditions. And I will be very honest with you, I have all of these except for one. So I can speak to this and the importance of this. The benefits include zero copay if you're seeing your PCP and your condition. The reason you're being seen there is related to one of these conditions. That's the primary billing code. Zero cost for specific tier 1 generic medications, and you'll want to look for those on our formulary. I always suggest to people to make sure they have their exact bottle in hand or they've written down their medication so they can spell it correctly. And if you do Control F as in Frank, you can type it in and hit enter and the medications will pop up rather than having to go through 180 pages looking for it. 50% cost reduction for select tier 2 and tier 3 medications. And again, you'll see that on the formulary. The important thing to remember is in order to get these discounts on the medications, you must use mail order. And you all know how I'm a fan of mail order too, and we'll be talking about that in another slide. Next, please. So this is the chronic illness support program. My eyes are too bad at the moment to read all of that from here, but I can get my magnifying glass, but that wouldn't look very professional. So, but it hasn't changed much. What has changed is the insulin, the purchasing of insulin is no longer part of the CIS program. But it's a wash for those that are on the CIS program, and actually better because all insulin is now covered at $35 and it cannot exceed $35. So this is a good benefit, a better benefit for those diabetics. But this program is fabulous. And what we found with this is that, for instance, you know, being a diabetic for many, many, many years, having a program like this definitely helps people to have no excuses for not taking care of themselves, meaning you go to see your primary care physician and that the code on that billing is diabetes, you pay a zero copay. You see your endocrinologist and the billing code is, you know, diabetes, you pay a zero specialist copay. And listen, I've had my time through life where I have not always been the best diabetic, but this will keep our members healthier. They'll have better A1C numbers, and it will keep them out of the hospital or emergency rooms or walk-in or urgent care centers related to, you know, issues. So this is a great program for these particular chronic illnesses.
Hey, Tammy, it's Sharon. I just want to add to the group, and probably it goes without saying, but the chronic illness support program as it is today, in case there's confusion about when the $35 kicks in, and I know you're going to talk a little bit about that, but I do want to just add that the chronic illness support program as it exists today for 2020 plans will remain the same. In other words, diabetics will continue to get their prescriptions through mail order. It's when and upon renewal in 2021 that the $35 insulin copay comes into effect and the changes for CIS take effect too. Yes. So maybe it goes without saying, but I just thought it was important to add.
Thank you. It's coming up. Thank you. So oral health, as you all know, is a very important part of your overall physical health, and we are continuing our partnership with Northeast Delta Dental, NED. The partnership offers large group employers a discount on their medical rate. So we will, whenever I provide you a quote, I will provide a quote with and without the NED discount, which will mean that you'll see a 1% reduction on our medical rates. And NED will provide a 5% discount on the rate. The important thing to keep in mind is that in order to be eligible for the NED discount, you must have a minimum of 51 employees enrolled on the NED benefit. So sometimes you'll probably look at my quotes and say, well, why are you offering me a NED discount when, you know, I've got only 45 enrolled on the medical group? The reason I do that is because you may have a number of waivers, and, you know, those waivers may not want the medical plan, but they may want the dental plan. The other thing to keep in mind too is that the medical renewal must follow the dental renewal. So that's important to remember as well. But we have been wildly successful with this. This will also be implemented for the ASO market as well. And the 5%, the 1% decrease in the fully insured is 1%, and that same decrease will apply in the ASO business, and that will be discounted on your, oh, I'm having a brain cramp.
Admin.
Thank you, admin costs. So that's a good opportunity too with the bundling. And next slide, please. Life Balance, again, has been a very successful program. They offer discounts of all sorts. So if you're like Renee and you want to go skiing, she can get discounts. Anybody can get discounts. Yoga classes, hotels, cinemas. There's a long list of what's available. And definitely take advantage of this because it's keeping us all active. Next slide. Okay, the pharmacy overview. So again, to tag along on Sharon's comments, in 2021, we will have 2 formularies. So anybody that enrolls with us beginning January 1st will have access to the new formulary. As groups renew, they will then move to the 2021 formulary. So new business starting January 1st will have access to the 2021 formulary. Anybody that renews in 2021 will then move into this new 2021 formulary. And that also goes for the insulin provision as well. So as your groups renew, they will then have access to that insulin provision. And until then, they would still have the 2020 CIS program where they would still benefit from the insulin on the CIS plan. Thank you. ACA preventive drugs, HSA preventive drugs, the Narcan and naloxone, there's a 0 cost there for that. We will continue with that moving into 2021 to remove any barriers. Tobacco cessation is also remaining with zero cost share. Blood glucose meters, again, and I'm not going to read all of this line by line, and there again, you'll see the insulin for the 30-day supply upon renewal. Chronic illness support, again, and that site of care incentive is really an exciting program. Home delivery. You know I can't talk anymore about home delivery. I am the biggest fan of home delivery. I've been using home delivery for, I don't know, probably 17, 18 years. It is convenient. I never run out of medication because I've got auto delivery on all my meds, so I don't ever run out, especially this time of year when, you know, we're so busy and I can't get myself to a drugstore. This is a great plan, and folks can sign up for the home delivery right in their member portal. There's a link to go out to Express Scripts, so it's very easy. It's certainly not like the old days where we had to get a paper script and complete a paper form and mail it in, and it's so much easier now with our portal and the Express Script component of our portal. And again, remember, mail order, you must get your medications through mail order in order to be eligible for those CISP benefits. Specialty medications, again, we partner with Accredo Specialty, which is an arm of Express Scripts. These are our typically tier 4, tier 5 medications, the medications that are very, very costly. If you watch the evening news on any channel at night, you will see ads for all of these new medications. Ask your doctor, ask your doctor. These must come through Accredo. '21 plan details. Next slide. Excellent. So as I said earlier, 2020, this is the new RX1 and RX2 plan options. So RX1, $5 copay for tier 1, $25.50 for tier 3, 30% coinsurance limited to a max of $300, and 30% coinsurance limited to a $500 max. That is very, very similar to the current RX2 benefit, but a tad richer. What we've introduced again is RX2, and this has a $0 copay on tier 1, a $10 copay on tier 2, tier 3, $45, and tier 4 and 5, 20% coinsurance to $200 and 20% coinsurance to $400. These two options are available with a January 1st effective date and moving forward through 2021. And again, as I said earlier, if you've got, I've got several January renewals that are currently all on RX2, the old benefit. They're moving to the richer RX1 benefit moving forward. But certainly if you've got a renewal and you want to see the new RX2, just let me know and we can show it to you that way as well. Next slide. Administration. Excellent. So these are our online insight, our new online insight and tools. As we had mentioned earlier, we have a brand new fresh look now in our portal. It's very user-friendly. You have the ability to print ID cards, advanced search capabilities, available census for download, although don't download any census information because I know what you're going to do with it. Anyway, administrative ease, home form, group quoting to enrollment, from group quoting to enrollment. Now we did roll out our new large group portal for RFP submissions. For any of you that did not, were not able to attend our training, certainly reach out and we can work with you to train you on our new portal. But this is what the, That's okay. The dashboard page is what you're going to see first when you log on. Next slide. This is a copy of our reporting capabilities in the large group. It's a very concise package, but what I will add is that we now have implemented the top 20 drugs that are being utilized by the group as well. And that was thanks to feedback from some brokers that wanted to see that information. And if you have any kind of comments when you see these, certainly let me know. But our reporting package is very concise. And next, the market verification form. So some of you may have received the market verification form. These go out to all large groups. They also go out to small groups who have no membership. There are no members on the group at the time of renewal. And it also goes out to groups that have 1 or 2 employees enrolled. And then in the small group market, we will send these out for groups that have 30 or more enrolled. The reason we do this is to make sure that the group is being rated in the proper market segment. And you'll see on the market verification form that it asks you to complete the market verification form based upon the prior calendar year. So COVID has been a little bit of a difficulty this year, and I actually had a couple of the market verification forms come back that I knew were large groups, but because they had COVID furloughs and layoffs, they had completed it in the current year. So just a friendly reminder that it is completed on the prior calendar year. And the other good news with this market verification form is there are instructions on the back that help you to answer any questions you may have. We send these out 75 days prior to the renewal, which can give us time to review them and then put them in the appropriate market segment. I will tell you, please get them in as quickly as possible. I actually have a December renewal still waiting to be reviewed because I haven't received the market verification form. But no worries, they'll get their renewal, whether it be small or large, as soon as they get it in-house. Next. This is a new business checklist that you probably will find very helpful. It can be used for both small and large group. It gives you some information as well as to what the requirements are for documentation related to the main 941, and if you've got a group with partners, the K1s and that sort of thing. So this should be very helpful and useful for you as well when you're getting ready to enroll a group with us. All right, everybody sitting down, everybody ready? Everybody ready for the big announcement? Deductible credit. You're all going to be happy. Upon moving to Community Health Options, members will receive both deductible and coinsurance credit incurred from their previous carrier. Deductible and coinsurance amounts will credit toward the new out-of-pocket maximum with Health Options. Copayments and other out-of-pocket expenses from another carrier will not be credited. Deductible credit reports from the prior carrier should be submitted electronically from carrier to your account manager. These will be accepted within 60 days after the effective date of the plan. I always suggest to brokers to request that that deductible credit report with around day 45. So it captures as many of the claims from the prior carrier. Individual explanation of benefits, EOBs from members, will not be accepted. However, we will review that on a case-by-case basis as needed. But electronic is the best way to get it to us. Everybody can take themselves off mute if they want to say yay. But this makes us much more competitive in the marketplace. So we're very happy to be rolling this out. And next, and I'm going to turn it over to my friend Maureen because she is our individual coverage ICRA specialist.
Well, thank you for that, Tammy. Hello, everybody. And yes, I've kind of taken this under my wing as a cooperative and a collaborative effort to support brokers, you know, appointed with community health options. It seems as though I'm getting a lot of calls and questions about individual coverage HRAs, or otherwise known by its acronym ICRA, and its counterpart, which is QSERA, and we have a slide on that as well. Just to give you a brief overview of ICRAs, they can be put into a group of any size, and it can be put into a group of any size and also have a group health plan in place. There are 11 classes of employees that can be carved out that can be put on an ICRA. So those 11 classes, you can actually Google them and they're readily available. Just as an example, like part-time employees, seasonal, there are 11 classes of employees. Also within those 11 classes, you can group classes to, I don't want to say group classes together. You can choose 2 classes or 3 classes or all 11 classes to have an ICRA put in place. I would also like to remind everybody that ICRA and QSERA are both administered by a third-party administrator. We have several available here in the state of Maine. Employees need to sign an attestation, and confirm that they've taken the money that the employer has provided and gone and purchased a plan. Those plans the employees purchase can be from any carrier. That's also something that should be noted. So if the group plan is with Community Health Options, employees can also shop for Community Health Options and the other carriers in the state. So that said, we didn't include QSERA. My mistake, thank you. Just to note, QSERAs are for groups under 50. And those groups under 50 cannot have a group health plan in place. So just if you were, wondering, this is the large group segment, so my apologies.
I also want to mention one more thing that I missed in my presentation. Behavioral health, we have introduced as of midnight this morning. Behavioral health, we now have our proprietary network up and running. So that's all in-house too, all in-house now too. Can you tell I'm overwhelmed? But we have, it's now in-house. We are no longer using the behavioral health care program. So this is great news for us as well, starting today. Thank you.
Great. Thank you, Tammy. And thank you, Maureen, and thank you, Renee, for jumping in and assisting with today's presentation. Just a few housekeeping items as we begin to end our session. First of all, thank you for coming. We hope this format is meeting your needs. And I do want to reiterate something Tammy stated earlier, which is these Zoom sessions just don't seem to have the same vigor that our regular in-person sessions have. And so anyway, it's made me sad, but I'm grateful that we can at least connect via Zoom to continue our important work. Ariel is planning on sending a copy of the slide deck out. Just a reminder to everybody, the email address, if you'd like to submit questions, or if there's someone you'd like to reach out directly to, or maybe have some one-on-one time with on the telephone, we're happy to make all of those types of things happen. But feel free to use this email address, which is businessdevelopmentinfo, all one word, businessdevelopmentinfo@healthoptions.org. And we'll field those questions through that mechanism and get back to you as soon as we can. But other than that, that ends our session for today. And again, we have one more training session tomorrow covering the individual market and for brokers who write and really cater to our individual and ACA business. And if you'd like to join us, you're more than welcome to do so. With that said, I'll sign off and tell everyone, great day.
Have a
Thank
great
you,
day.
everyone.